Hi guys, welcome to my channel. My name is Benta, and if you're new here, make sure you hit on the subscribe button and also like this video. So to all my new subscribers, I just want to say a very big thank you to you guys. I really appreciate it, and you are welcome to my family. And yeah guys, let's join and build this family. If you're watching this and you're not subscribed yet, what are you waiting for? Go ahead and hit on the subscribe button. Okay, so let's get started. So today's topic is a very sad one for me and for the Gambian people, especially the Gambian women. Okay, for the past 1 month, Gambians have been on social media talking about Gambian issues, especially the mortality rate in the Gambia. And this is why today I decided to make a video, because this video is focused on the mortality rate of pregnant women in the Gambia. Okay, it is so sad that we have a lot of deaths within just a few weeks. So if you guys don't know, we already have 16 women who died of negligence of our healthcare professionals, and this is the ones that we know. This is the one that has been out on the media. This is the one that has been out on the public. And I can tell you that there is a lot more women that have died due to negligence during childbirth that we don't even know about. So basically, this could even be a quarter of what we know about. Isn't that sad? So if you are Gambian, I'm sure we all have already heard about a story or stories of women who are giving birth and being abused by their healthcare professionals in Gambia. And I think I have been hearing such stories since I was even young. You know, way before I even got married, I used to hear about stories that says that doctors and nurses will abuse pregnant women when they're giving birth, especially when you are yelling or crying while you are in pain. They don't want to see you yell or scream. All they want you to do is shut up, and they will tell you to shut up. And we have always heard of stories of healthcare professionals telling pregnant ladies in labor to be quiet, because that is not the way they were yelling while they were doing it. Wow. This is the most disrespectful thing I have ever heard, and the most inhumane treatment that I can ever see anybody do to a pregnant woman. You know, how can you watch someone in pain, someone giving birth? Their life is at stake here. Women, while giving birth, are between the state of life and death. And for the fact that somebody can look at a woman in labor and tell them that, be quiet, because this is not the way you were yelling when you were doing it. If that was in America or any part of Europe, boy, you would lose your license in a snap of a finger. The kind of abuse and negligence that the Gambian pregnant women are going through is unacceptable. This needs to stop, and it needs to stop now. This negligence is not only from the healthcare professional, which is the doctor and the nurses. This negligence includes the Ministry of Health. Before doing this video, I contacted a friend who was working in the Gambian healthcare system as a registered nurse. So I decided to contact someone who knows a lot about Gambian healthcare system, because I wanted to get as much information as possible. I do know a couple of information about the healthcare system, but I thought it would make sense to just contact somebody who had worked in the healthcare system, you know, longer, and basically someone who has been there longer than I was. Okay, and my very first question to my friend was, all these women that are dying, why are they dying? What exactly is happening with our healthcare system? Because it is very abnormal for women to be giving birth and dying. It's okay for women to give birth and die, because that can be caused by anything. They could have like complications due to childbirth, complications due to pregnancy, complications due to other kinds of sicknesses they have, okay? But the amount of death of women in labor is just skyrocketing. And for that reason, something has to be wrong somewhere. And sad enough, her number one response to me was healthcare professionals not knowing or not sticking to their scope of practice. And that left my mouth open, because that is the worst thing that can ever happen to any healthcare system in any country. You having people in the system that don't have any connection with the type of job they're offering to the people. You hiring people who don't have license to perform the job you're hiring them for. You hiring people that are not trained for what they're doing. Unbelievable. Okay, let's talk about knowing and sticking to your scope of practice, since this is the number one problem that we have in the system. First of all, who is policing our healthcare workers in the Gambia? Because you cannot have somebody who is a CNA or SRN, I think they call them SRN in the Gambia. You can't have an SRN do the job of a registered nurse. You have someone who did not even go to school do the job of someone who went to school for 3 good years, and you expect everything to be perfect? Who is controlling all these things that are going on? I heard that if you go to the labor department, there is a lot of healthcare workers that you can find there. But most likely, if you have found probably 5 healthcare workers in the labor department, only 1 might be an RN. The rest of them, considered midwives, does not have even a 2-month license to practice. Do not have a 2-month certificate to show that they even went to school, or they even had some kind of training to be in that department. I don't see any reason why an SRN or an CNA should be in the labor department doing the job of a doctor or a nurse, doing the job of a midwife. And the problem we have in Gambia is that most of the time when people go to the hospital, they cannot even differentiate who is a nurse, who is a LPN, who is a SRN, who is a CNA, or who is a... The only thing that matters is that everybody wears one uniform, which is white. Everybody wears one uniform because everybody wants to be considered a nurse or a doctor. And all that is supposed to be blamed on the Ministry of Health and the DONs, which is the Director of Nursing. Sometimes I wonder, do we even have Director of Nursing in Gambian hospitals? Do we have one in the biggest hospital in the Gambia? Because for us to see such things going on, for us to see CNAs wearing the uniform of a registered nurse, CNAs doing the job of a registered nurse or the job of a doctor, it simply means that there is nobody who is in control of that department. And if we have one, then what are you doing? We probably need to look at the DONs themselves and see if they even deserve the kind of job that they have been given. Do they deserve that position? Because if 1, 2, 3 people should die in 1 week in the labor department due to negligence, then there is a problem. You as a Director of Nursing, you as a Minister of Health should get up and go find out the problem. It's about time the people with the right license stick to the jobs that they're supposed to do. And the people that have SRNs or CNAs stick to the kind of job they're supposed to do. Let everybody stick to your own profession. There is no way a CNA in America or in the UK can give medication to somebody without even being trained. It's not even possible. You are not even allowed to give this, even paracetamol you cannot give to a person if you are not trained to do so. So how our CNAs get the positions of midwives is baffling. It's crazy. And this, we need to talk about this. This is crazy. No wonder why our people are dying every day, left, right, and center like chickens. Ministry of Health, the life of the Gambian women are in your hands. The present government of the Gambia do not give a damn about what goes on in the healthcare system. And this is sad because the healthcare system in the Gambia is one of the places that needs immediate reformation as this government came to power. But it seems like this is the less cared department they've shown any interest on. Nobody even cares. Look at when the president came to power till today. None of the Gambian people have ever seen this man in the hospital to even look at how things are going. But all along, people are dying every day because there is no medication. People are dying every day because of negligence. Poor people cannot go to the hospital because when they go, they cannot get medication. Every time someone goes to the public hospital, all they do is write you meds and tell you go get it at the pharmacy. And because of the price of those medications, some people don't even want to go to the hospital. They would rather die or take local medications than go to a public hospital. All because our leaders do not care about what goes on in the healthcare system. You know, my friend told me a story of while she was in the hospital. Listen to this. A nurse, a registered nurse, standing beside a doctor and a pregnant woman. Mind you, I'm talking about a doctor. Now I'm not even talking about a CNA, SRN, or LPN. I don't think Gambia even have LPN. But I'm talking about a doctor. And this person, as a nurse, is supposed to learn from this doctor. She said she listened to a doctor telling a pregnant woman in pain to be quiet. Hey, be quiet. Is that how you were yelling when you were doing it? A doctor of all people? You know, even if they say it's a CNA, you don't even have the right to do it no matter who you are. But if it's a CNA, I can be like, well, what do you expect? Because the person didn't even go to school. Why are they performing delivery on anybody? But a doctor of all people? And there is somebody standing right beside you who is supposed to learn from you. What lessons do you think you're giving to that person? That being aside, accountability, another big problem we have. Our healthcare professionals are not being held accountable for their actions. And this is why they can do what they want to do. They can neglect patients for as much as they want. They can leave a pregnant woman in pain to die just because nothing is going to be done about it. And that is just the truth. But this is the number one reformation that we need to do in our healthcare system. If you do something, you have to be held accountable. If you neglect a patient till they die or end up having other complications due to your negligence, then you need to lose your license ASAP. You don't need to practice. You don't need to be in the healthcare system. Until we put such systems in place, this is what's going to happen. People are going to be dying from one hospital to another. And this includes even private hospitals. I'm not talking about public hospitals alone. I'm talking about private and public hospitals. Because the private hospitals are even the worst, which only the rich people can afford, or people that have a little bit of money. So many people in Gambia prefer to go to a private hospital than a public hospital. Because of why? Because of the negligence and incompetence of our public workers. But the sad part of going to the private hospital also is that you go to a private hospital to get treatment, hoping to get the best treatment there because it is private, yes. But then when things get out of hand or get worse, they want to refer you to the public hospital. So what is the essence of going to private? Or we have also heard of stories where people will go to a private hospital, then when their situations get too complicated, they take them to a public hospital, and the healthcare professionals in the public hospital are bluffing not to touch you. Why did you go to the private hospital? So we're going to leave her there to suffer. Excuse me? What is your business if somebody chooses to go to a private hospital? Your job is to take care of them as the nurse or as the doctor that you are. That is what you sign up for. You sign up to save lives. You sign up to support your patients. So what right do you have to talk to somebody like that, to disrespect another person, or to neglect a patient just because they went to a different hospital? And so many people have lost their lives just because they chose a private hospital to a public one. That needs to stop. It's about time. Gambia, if you are a patient in the hospital, they need to tell you all your rights and what to do in case you felt you have been abused. They need to give you numbers to report to. In fact, the whole Gambian public needs to have a number to report to. We need to have some type of ombudsman going on. So what ombudsman mean is a system whereby when someone feels like they have been abused or neglected, especially in the healthcare system, they can call and report. And those people responsible for that investigation will come ASAP to investigate that situation. And I'm telling you, real investigation. I'm not talking about the African corrupt investigation. And it's not only the person that has been abused that can report. If you are a patient and I feel like you have been abused, even if you don't feel like you've been abused, if I feel some type of way that you have been treated in an inhuman way, I can call and report. We have a lot of things to work on. But the only thing that is important to our government is just, I don't know, it's everything politics. It's just how for them to be chosen for next election. And if your women are dying like that, I even wonder how you're going to win the election. Because mind you, it is women that help these presidents to win election. Every election, if you don't have women on your side, honey, you are not going to win. And these leaders know that. So when it's time for election, they try to bribe people, they try to bribe women, they try to bring women on their side as much as they can. And after the election, they abandon them to their fate. Maybe because of COVID, things are even difficult for them to travel. But today, if our president should get sick today, or if his wife is supposed to deliver a baby, guess what? They're going to be looking for a way to fly themselves out. They're going to be looking for a way to fly themselves out. Because there is no hospital in Gambia that is fit enough for them to give birth. And this applies to everybody in the government sector that have money, the ministers and their presidents. They are quick to travel out of the country for a better healthcare system. Why don't you put a good healthcare system in your own country? You don't need to travel anywhere to get good care. Talking about government officials flying themselves out or flying their family members out for treatment, all that money that you are going to be spending abroad, because it's not going to be free for you. All that money they are going to be spending abroad, why not put it in your own country? Why not put it in your own healthcare system? Why not pay your doctors and your nurses a good amount of money for them to stay and practice in the country? It's funny that we have only one nursing school in the Gambia, basically, because I feel like that is even one of the reasons we are going through all these problems. Because I want to say some words, but I don't want to say it, because if I do, YouTube is gonna flag me. But that is the main reason we're having all these issues going on, because we don't even have enough nurses and enough doctors in the Gambia. We have only one nursing school in the Gambia. And let's say you have 50 people in one class. Those 50 people are going to graduate in 1 year. And those 50 people are going to be distributed in the entire Gambia. So basically, that year, you have only 50 registered nurses who are going to be distributed in the healthcare sectors from Banjul to Katong. And this is why they have to hire people that are not fit for the job. And this is why it is CNAs that do the job of a midwife, telling them, oh, go ahead and kill that lady that is giving birth. Because that is how I say it. If you put a life of a woman in labor in the hands of somebody who did not go to school for even 2 weeks, you're basically telling them that go and finish them up, go kill them. I can't wait for that day that these big government officials will get sick and not have nowhere to go to because the Western world have locked their doors. Then you're going to see what your people are going through. And for Gambian men, this is the time that women need you to stand by them, because your women are dying. Your wives are dying in the hospital. Your sisters, your mothers, your aunties are dying in the hospital for nothing. I heard that women are doing a march on September 23rd. I'm pleading with all the men to join this march and show your anger. March all the way to the State House. It is your right. It is our right to protest. It is our right to show our anger. A good healthcare is a basic right for every individual. This is just a basic right for all of us. Gambia is too small to be going through all these things, and we have different things that we're going through at one time. With just 2 million people, we have a lot of things that we need to tackle. But it seems like nothing is being tackled as of now. And then we have someone sitting in position for the past 4 years and nothing to show. All these women that died, they have left behind children who are now orphans. All these children that have died have left behind children who are now orphans or half orphans. This is not fair. A good healthcare system is a basic need for the entire nation. Nobody is supposed to tell the government what they need to do in the healthcare system. They know better. They know better because if it's their time or the time of their family members to give birth or need healthcare assistance, they know how to go out and get it by leaving the country, flying abroad. So you know you need it. Work on it. One day you're going to need to travel and you will not get it. You think the West wants you to be there? They just want to get your money. Because you coming from Africa to treat yourself in America or the UK, you will pay 10 times what the regular person in America is paying. You think these people are nuts? And you're wasting the country's resources to treat yourself as if you are the one that put it there. Gambians, get out and march. Get out and show them that you're angry. Stop killing our children in the healthcare sector. They don't deserve to die like that, and they don't need to die like that. Nurses and doctors, stop neglecting our people. Oh my God. This is so sad. It's really, really sad to get up and see nothing but death of women in labor due to negligence. Like, this could be anybody. It could be your sister. If you don't think it's okay, for people to come out and talk, well, let it be your own family and see how painful it is. It could be your sister. If it's not me, it is you. Your brother, your sister, your auntie, your child. It could be anybody. If the government don't do something, let the people do something then. Get up and fight. Let's get up and fight for ourselves. Let's come out and talk. You know, the media is here for that. Let's come out and talk. Talk about all the things. We can't be sugarcoating everything. We need to talk about the things that go on in Gambia, all the wrong things that go on. And there's a lot we need to talk about, like so much that we need to talk about right now. I don't even know what we accomplished over the past 4 or 5 years. I can't tell. I go to the internet, look, there's nothing that we've accomplished these past 4 years. Sad. And this is why we need to be careful of the next person that we're going to be choosing to be in office. Just because we want to get rid of someone does not mean that we have to jump into a well deeper than the one that we came from. We need to watch out for the person that is going to stay in position for the next 5 years, because the smallest mistake we make, we're going to be in the jungle again. Because one small mistake we're gonna make is a disaster. That's another 5 years of darkness. So we need to watch out. We need to be careful and choose our leaders the right way. Don't just come and start choosing people that don't go to school, or people that went to school but don't know nothing. They don't even have experience. Because being a leader at this point, to me, it's not even about going to school anymore. Because there are a lot of people that did not go to school, but when they sit in the media and talk, what they say is just common sense that anybody should know about. It's just common sense. It is what it is. Whew. Well, and we need more people to come out on the media and talk. Let our voices be heard. If you're a Gambian and you're in the media, let your voice be heard, okay? Anyways, I think I'm gonna do a Mandinka and Wolof version of this, because I know there's a lot of people that need to listen to it, Gambian people that don't understand English maybe, or prefers me to say it in Mandinka and Wolof. So I'm gonna do that video as well, okay? So yeah guys, be sure to subscribe to my channel if you're not, and also like this video, and I will see you in my next one. Bye guys.